Can you hold up for just a second? I have that computer on.
Looks like maybe you can hear us now.
Yeah, I can hear you just fine, but it was incredibly screechy there about 2 minutes ago.
Good, okay, yeah, so
Sorry.
it looks like we're back on track here. So yeah,
Thank you.
it was echoing back in the room too, so we had to just stop for a moment.
It was reading from the script. That's right.
Okay, here we go. So, yeah, thank you for being flexible today. I was able to participate in the regional solutions interviews for a couple folks today. So that finished it right before 3 o'clock. So that's how this changed to the last moment. With that, let's go to item number 1. Document rendering board decision for Thornburg Destination Resort.
All right, good afternoon. For the record, my name is Caroline House. I'm a senior planner with the Deschutes County Planning Division. And so I'm just here today to review the board's draft decision for the Thornburg modification and answer any questions you have. And just as a reminder, today is the 150th day. So we're in a tight timeline to get that mailed.
We're just reading the mail before 5 o'clock.
4 o'clock, I have to,
4 o'clock,
I have to
okay.
drive to the mailing facility right after this, so.
So this is the written decision. We have deliberated and made a voting decision on this matter. So this is the final written decision. Any discussion and thoughts?
Well, it'll be no surprise to anyone that I do not support the written decision as written. I continue to believe that the hearings officer's concerns were well reasoned when the hearings officer rejected or did not support moving forward this application by the applicants and the appellants, who then became appellants. My key concerns are still that I believe the Oregon Department of Fish and Wildlife's opinion on this fish and wildlife mitigation plan should be a consideration in approving this application. And number 2, that this application does not provide adequate assurances that mitigation water is going to be produced or provided in the right places to ensure that there's no net loss of habitat. Again, that's just echoing the findings of the hearings officer. I'll be voting no.
Very good, thank you. So at this time, any thoughts, Commissioner Dare, or a motion?
Yes, I do have one thought. Carolyn, I don't know if it's possible. I did pick up on page 6 of 15, and if you could search the whole document, it just says Mr. Lucius Caldwell, and he's actually a doctor. It's in item number 11, the very last line. He's referred to as a Mr. And I was just wondering if we could be sure that he is always referred to as a doctor throughout this document.
Yeah, I can definitely update that.
Okay, I didn't know if we have time or not, but anyway, I just would, yes, if we could do that. I don't know if you can do a word search in the document, just to make sure I didn't miss any other ones.
Yeah, he's mentioned in the table on packet page 10, page 736, but it does say Dr. Lucius Caldwell there, so.
Yeah. I mean, that can be updated. I'll need
Yep.
to run a copy real quick, but yeah.
Okay, good. So do you want me to make the motion then?
Yes, please.
Okay. My motion is to approve board signature of document number 2023-382, rendering the board's decision on file appeals number 247-22-000678 MC 984A and 247-23-000003-A. That's 5 zeros and then an A.
Okay, thank you. And I will second it. And for discussion, this is a process. This is a long appealed matter. The Thornburg Destination Resort. This is just for the Fish and Wildlife Mitigation Plan modification approval. And I do support that there appears to be net benefits for fish and habitat. There's a lot of, big picture about water and drought and lack of water, but water rights are water rights, and I do support that from the applicant's point of view. And yeah, so I'll be supportive of this. Any other statements, Commissioner Dare? Colin,
Water rights are water rights, and it does appear that they have their water rights.
Okay, so then call for the vote. Commissioner Dare,
Yes.
Commissioner Chang,
No.
and chair votes yes. So thank you very much. One slight edit. Thank you very much for getting the
Yeah.
package together. We're cutting it close.
Yeah, so I'm gonna go and make that change and bring it back for Dave's signature and then ask if the board could sign that as quickly as possible.
Okay, yeah, so so Commissioner Dare is in the building. She said head cold, so she stayed in your office. So we'll all be available for signature.
Okay, thank you.
Okay.
I guess I would just like to respond to that comment about water rights. You can have water rights. They can allow you to take water, they can allow you to exchange water, but that does not guarantee that there will be no net loss of habitat, which is the criteria that we're trying to address with this fish and wildlife mitigation.
Okay, we're right on schedule at 3:10. So item number 2, Healthy Schools Program Update. Hello, everyone. Welcome.
Hello, thank you so much. For the record, we'll introduce ourselves first since there are several of us. I'm Jessica Jacks, Prevention and Health Promotion Program Manager. And
I'm Laura Nordquist, Deputy Superintendent of Benton Schools.
Hi, I'm Dean Richards. I'm the Director of Secondary Curriculum Instruction and Systems for Benton Schools.
I'm Amy Snyder. I supervise the Healthy Schools program for Deschutes County.
Thank you very much for joining us.
thank you. I actually wanted to start off just appreciation to Commissioner Adair, who requested that we be here in this time frame so that we could speak prior to the budget committee. So thanks for getting it on the agenda, and Commissioner DeBonne and Brenda, thanks for accommodating our time request.
Well, it got moved a little bit, but we're here now.
Yeah, appreciate that. So our Ben Lapine School partners won't be present at the budget committee like we have been in the past. So just wanted to have this opportunity to dialogue and address any questions should there be any before we head into that zone. So I wanted to just really briefly share before we launch into the slides how very humbled and impressed I am by our staff in our prevention and health promotion team, our Healthy Schools program led by Amy Snyder, and our staff that work in the schools have done an amazing job in just a year and a half's time. And we're now able to share some things that are happening, whereas before we were, putting pieces into place, and things are looking really, really well. I also just wanted to reflect that for our prevention team, the larger prevention team in terms of prior to having Healthy Schools, there was a prevention team. And we, as a whole team, are much more effective and efficient with Healthy Schools. So we are able as a team to address more quickly the concerns that are coming up for students, staff, and parents in our schools and Ben Lapine schools, specifically with Healthy Schools. And we are assuring that those things are effective so that they will actually create the change that we're intending: healthier students, healthy student behaviors, graduation, improved graduation rates, and launching our students into a more productive life as an adult and citizen. So really, really very excited to be here at this point and share some results with you. And also just grateful and want to say thank you for allowing our team to be good stewards of these resources and create this change. So with that, we're going to launch into our slides.
To start us off, I just wanted to share a little bit about our why we need healthy schools, why we have healthy schools. This slide shows us data from the Bend Lapine Schools 2023 Youth Truth Survey, which was January of this year. And the big thing to note on the left-hand side is that about 50% of our middle and high school students are reporting that feeling depressed, stressed, or anxious is a barrier to their learning. So students were asked what of these things were preventing you from doing your best in school, and the primary reasons were health issues. Other ones that you see on this slide are also distractions at home or family responsibilities, their own personal health or their personal relationships, as well as in middle school, you can see a higher bump in feeling or being picked on or bullied or not feeling safe in school. And these are all things that we're working on with healthy schools. This slide shows you an image of our team. So the very top row is what we call phase one. That's Amanda on the left-hand side in Lapine High and Lapine Middle. Those are the school logos that we are assigned to. Lindsay's in the middle with Bend Senior High, Pilot Butte Middle, and Bend Tech Academy. And then myself are, let me move this down, is me right there with the district. So I work at the district level, similar to what the public health specialists do at the school level, I do for the district, serving as a sense of their district health coordinator. And then on the bottom row is our phase two and our phase three. So phase two is Lonnie at Mountain View High, Skyview Middle, and Realms Middle and High. And then Emily is at Summit, Cascade, and Pacific Crest. And then pending budget approval, we'll have our phase three, which starts in July 1st, 2023 at Caldera High, High Desert Middle, and Three Rivers, K through 12 or K through 8. And we're serving the middle school level for that. One thing to note is when we start our program, we start at the main high school level. So when Amanda and Lindsay started, they started at the first school of their icons over there. So Lapine High and Bend Senior High. And then I started with the district, and that was what we worked on the very first year. Now they are in their middle schools. So Lapine Middle and Lapine or in Bend, Pilot Butte Middle now this year. And then at the same time was when Lonnie and Emily were starting at Mountain View High and Summit. And then we cascade down every semester now. We started a new school. This slide just shows our logic model. So if we are doing our healthy schools activities on the left-hand side, then we expect to see these short, mid, and long-term outcomes over time. So since we've been in the schools, 2 of the schools now and the district for a year and a half, we're expecting to see those midterm outcomes. Some of the schools though are just in their first year because they just started this year as we cascade into those new schools. So they're going to be reporting their short-term outcomes. And we kind of cascade through the district in that effect. On the bottom of this slide, oops, let me go back. The red circles are what I'm focused on reporting today at this kind of mid-year, about a year and a half into the program. So we're reporting on some of our short-term school community engagement in the school health improvement process and increasing our capacity for being able to deliver effective best practices. And then midterm, I'm reporting some work that we've done to increase collaboration and integration, increasing evidence-based practices or effective best practices, and then improving linkages to care. On the bottom of the slide, you can see these icons that I've added. So there's a little square that shows the healthy schools icon in gray, and then there's the short-term outcomes in gold, the midterm outcomes in green and long terms, and I'm using them as a key as I go through. So if you look at the bottom of the slides, it'll tell you whether I'm reporting on one of our activities or on a short, mid, or long-term outcome. To start us off, I wanted to talk just a little bit about the work that the public health specialists are doing at the school level. So this section is about school work. On this slide, this is a slide I showed in October 2021, when we first gave an initial update about the program. On the left-hand side is what the Oregon Health Authority defined as the sustainable core capacity for school health. And it says that if we have these 4 main components or active ingredients in our work, then we will have these outcomes that are on the right-hand side. So this is essentially what our program does. On this left-hand side of the slide, we put in our public health specialist who works as a school health coordinator. They convene a school health team that meets 4 times a year, which is the CDC's recommended practice. They do an evidence-based assessment, that's the CDC's school health index that we use, and then they create an improvement plan, essentially an action plan that identifies the priorities they're going to focus on in the work they do together as a school. And then Oregon Health Authority's analysis found that schools that do that work resulted in those mid and long-term outcomes, and that's part of our rationale for why we do this program. So this is where we are so far on our reaching the core capacity for sustainable school health. So the school icons that have the yellow circle around them are ones that have reached this core capacity. So 6 of our schools so far at this point in a year and a half in have reached that core capacity. And then by the end of this school year, we'll have 3 more. So 9 of the 15, if you count realms as 2 schools, 14 if you count realms as 1 school. And this shows why this work takes us a time to be able to implement. It takes us about a semester to get a school started in their school health improvement process. But we engage many people in that process. So across those first 6 sites, we've had 16 administrators. So those are the building principals or assistant principals. We've had 68 staff, which could be counselors, nurses, it could be FAN advocates. It may be health teachers, whoever at the school is doing a lot of this work already. 145 students who are usually groups of students who are already working on advocacy type projects. 137 family members. These are usually adult family members, caregivers of students in our schools. And then 11 community partners, such as our school-based health centers, primary care providers, or behavioral health care providers.
Amy,
Yes.
if I could jump
Always.
in here. I just wanted to highlight that one of the success stories that occurred in Lapine in particular, to put some context on, okay, these people are engaged, what are they doing? In Lapine specifically, it was prioritized a strong need. Their top priority was their counseling department based on a variety of issues. They were struggling in that particular setting. And because of this process and engagement with all of these people and that prioritization, next year, they are going to have 67% more counseling staff in the Lapine High School, which is really tremendous. Now, I think that equates to an additional 0.8 FTE, so there will be a full-time counselor, but that is tremendous, and that impact that consistency that staff will have with students is pretty profound. Thanks.
So there actually will be 0.8 more FTE where you have that much more capacity because there's people who are trained to do counselor activities.
Amy, you might want to chime in on this to make sure I get it correct.
I
But
know what resulted is that they received more FTE to be able to take their 2 counselors that they have and make them full-time counselors, and that's their role.
Support from health schools.
Yes, so, yeah, we had a 1.5 FTE for school counseling, sort of based on this data, and the other 0.5 was for a graduation coach. And so that is now 2.0 plus graduation coach funded through here, but it's this work as far as this data is helping us to say, wow, there's really, we're able to increase the support in this area.
Okay, thank you.
I think one of the meaningful things that comes out of this work is that it's the school who says these are our priorities. Often what we see is a counselor may say this is their priority, or an assistant principal may say it's their priority. But when we really bring together the whole team to say this is our school's priority and this is what we're going to focus on over the next 2 years, then that helps us be able to pull together the resources to do that priority. Otherwise, there's just a lot of disparate needs in the schools, and it's difficult to really address all of them at once. I think too, one key point about this is having all of these individuals helping with this process takes a lot of the weight and the burden off of the administrator's shoulders. Information go down through the principals in the schools, or the administrators, so assistant principals too, and then they have to figure out how that applies at their school, and they're often the sole decision maker trying to decide how do we do this, or if they want to bring together a team, they would have to prioritize that amongst all of the other information they have. And so this helps with having another person in the school that can help coordinate, and then we, if it's health related, sometimes push the information down through our public health specialists to help with doing that work if it doesn't require the administrator to have to do it. Any other questions on the school level? I was going to move on and focus on district for the rest. All right, so on the district level, this is my work that I do at the district, and this is just one kind of area of my work at the district, and I'm going to focus just on health ed for this, though we also do work in school climate and culture and family engagement and linkages to care, but I'm just focusing on the work that I do through health teachers. And I'm going to share just a little bit about where we were before we started Healthy Schools. From the stories that health teachers have told us when we started to bring them together as a group, is that they were really working in isolation. And as a former teacher, I can say it's very isolating to be in your classroom with, especially middle schoolers I worked with all the time. And that's who you're talking with throughout the whole day. And for health teachers, they didn't have shared planning time. So if they were working on planning or prep, they were doing it on their own, and other health teachers that were in the same building had different prep time, and they may never have met or have been able to sit down and do planning together. And that's within the same building. So it's especially difficult if they're in different buildings to ever be able to collaborate on their own. And that's a lot of what we've been able to do with Healthy Schools. So when we started this program, we were able to establish the first ever, as far as I'm aware, Ben Lapine Schools PE and Health Educator Network. So that's basically a professional learning community of PE and health teachers for the secondary level. So that's middle and high school. When we were able to convene them, we were able to identify what were their barriers to teaching and what were their priorities for health ed. We also were able to create an annual health teacher survey that we now do every year, so we can help with tracking how we're doing. We can be able to really get better data on what the barriers and priorities are. This photo represents some of the work that we've done with facilitating more than 55 hours of health teacher trainings or work groups. Some of these work groups happen when we are able to provide subs for the teachers and they're able to come together for a half day or a full day to work together as a cohort to do the planning and prep that they need to do. That's why it's very beneficial. We can pull them together and have them decide for us as health teachers, what do we need? And let's create that for ourselves rather than having someone else create something that may not be really fitting to their needs. So this picture is the first time we've ever been able to bring together Ben Lapine Schools, all of their middle school and all of their health teachers together in one room and spent 3 half days together planning. We looked at our student health data, we looked at best practices, and then we walked through the process of doing skills-based health ed. We also looked at curriculum and came to consensus about what do we want to teach and at what late grade level, and then made plans to continue that work. And then with Dean, I've been able to work through the district's process of increasing teachers' access and usage of effective curriculum. So we've been able to navigate through review processes. When we bring together the teachers like this, we can have them review curriculum, give us feedback on, yes, it's best for subject matter coverage, but it may not have the best teaching practices. So we want to know that. We have been able to do a public review process of curriculum through their district board of directors that allowed our prevention and health promotion and other community partners to be able to give feedback as well as community members. We also do some review processes with students. We got district approval to use new curriculum that's skills-based, effective curriculum. We were able to use our budgets to purchase and distribute curriculum. And then now we have consensus where where health teachers are field testing this curriculum as we lean into a curriculum adoption that's coming in 2024-25. So we're testing everything to make sure it's going to work, and then we'll have a really great system. I put on here this short-term outcomes because this is really that first year. This is building the capacity to be able to adopt those new effective practices.
And I would just add that in my tenure here with the county, we've been trying to do this for a very long time, and so more than 10 years, to put in some infrastructure together so that and it's not that schools and our work hasn't been compatible, but there hasn't been a system for it to land and be supported. So this is really tremendous, and that it's occurred in just a year and a half, and is going to have a really great impact.
This is feedback from teachers from that skills-based health ed workshop that we did the first time we provided them sub-coverage to come together. But I wanted to turn it over to Dean just to share a little bit from the district perspective of how this has impacted the district and teachers.
Thanks. What's really amazing about this partnership is the ability, so teachers have their minds in the right place, and that's thinking about the instruction of the students that are in front of them. This partnership has allowed us to be able to have a little higher look at a system and create a system with that support. So the structures of the Educator Network Day, where teachers can come together and talk about issues, to have that process of determining, like of pulling those health teachers together to say, these are the things that we need to work on. Here's what's getting in the way for our students and for us. Again, because teachers are isolated and their heads are down in the right spot, focusing on kids. The curriculum review process, so the state has 7-year cycles of curricular adoptions that the Department of Education sets. So we're in the process of looking at we adopted something 5-6 years ago. It was definitely before the pandemic. And the needs of our students have dramatically changed. So with Amy's guidance, we've been able to dig deeper into our supplementary curricular processes to bring things to us that we wouldn't know otherwise as a system, just because of that larger scale look to, oh, here's this curriculum that we know about from other states and other places. So that's been really helpful. Also bringing in the community feedback, again, beyond the scope that we would typically have of just, like students and families, being able to reach out to other healthcare providers to say, hey, here's some of these materials. What do you think? That's not something that our teachers typically have. That's just not, again, they're thinking about the things they need to be thinking about. So it's this partnership has really built these systems for us to be able to continue to support the health teachers, waiting on pieces from the legislature to increase our FTE support. So we have in several areas instructional coaches that would get in and help teachers implement the curricula. That's not something that we would ever ask Amy or anyone else here to do. So really get into those instructional pieces. So it's been really helpful, again, that big picture for us to be able to drill down and really provide the supports for teachers and kids that are necessary.
Thank you. I think that's something that I like to think about as somebody who's a teacher who's now a public health practitioner. We did a lot of assessments as a teachers to look at what's my students' needs, and then I plan my curriculum or my instruction around that. The part that's different about what we do in public health is we look at a system and we're like, what's the system's needs? And so I'm looking at the whole district as, a set of kids in my classroom and figuring out what do we need in health ed, what do we need in student services, what do we need in our data collection and sharing, and then navigating that systems approach. So if you can think of me as kind of a navigator for figuring out how do we move things through a system, and then I follow it through that system. So this slide shows you at the top a little bit of our logic model. So on the left-hand side, I will describe the Healthy Schools activities that we work on. On the right-hand side, I have one of our long-term outcomes. So that's specifically the student health outcomes. And in the middle, what you can almost see, it says increase evidence-based practices or effective best practices. And then it says curriculum. And so I'm just going to show you a snapshot of what our program looks like with just looking at the health curriculum. On the left-hand side, these are the 4 main program focus areas that we work on with Healthy School, Health Ed, School Climate and Culture, which could be things like policies or how we work together to have a warm, inclusive culture. Our family engagement work or our linkages to services or linkages to care. And then on the right-hand side, those are our student health outcomes that we're specifically targeting with our work long-term. And then in the middle, this is just showing you that array of curriculum that we're stitching together to give teachers a comprehensive curriculum that is skills-based, that is effective. We know it works to address these specific student health outcomes, and teachers have looked at it and they say, yes, we approve this. We think it's going to be effective in how we teach. And then we've had subject matter experts look at it and say, yes, this is aligned with best practices in this subject area. So this is how we're getting towards teachers improving their practices by using curriculum that's well scripted, it's well outlined, it's based on what we know works. And just to give a little description of some of the, let me find myself where I am in my notes. Catch My Breath, the one on the top center, is a program that has been found to reduce vaping in middle schoolers by half. Project Alert was found to reduce experimentation with tobacco, which includes vaping, by 40%. There's also a 60% decrease in marijuana usage, 20% decrease in early drinking, and 20 to 25% reduce in 30-day tobacco usage. And then Michigan model, which is kind of in the middle on the right-hand side, is a comprehensive curriculum that was developed by a state health department. And their program is effective at improving communication skills, reducing aggression, improving safety skills, improving drug refusal skills, and reducing alcohol and tobacco use. So for all of these, we look in them pretty in depth to make sure that they're effective at what we're aiming to address. And this is how we're targeting those student health outcomes on the right. Here's some of our results of the work that we've done with the health teachers. So this was comparing our 2021 and our 2022 health teacher survey. Those were done in October and November, respectively. When we asked them how the Healthy Schools partnership has affected them and their work, 100% of them said that we improved their access to effective skills-based health curriculum. 95% said that we improved their knowledge, skills, and confidence to be able to deliver effective health education. That was from those 3 sessions of intensive training that we did. 80% said that we improved their practices so that they are now delivering more effective curriculum and instruction. And then over that year, there was a 206% improvement in using effective skills-based curriculum, which was a change from 31% reporting using a skills-based curriculum to 95% are now reporting using a skills-based curriculum. So almost all of our teachers are reporting using effective skills-based curriculum now at this point, and that was in fall. We've done more training since then, and we have likely improved that since then. With this work that we're doing across district-wide health ed, that has the capacity to reach 7,000 Bend-LaPine school students. If we count up all of our middle school students who have a 6th and 7th, 8th health and PE class, and our health 1 and health 2 in high school. This is changes in teachers teaching certain topics. All of these topics on the slides are required in some kind of capacity, either by an Oregon state law or by the district's suicide prevention protocol, specifically suicide prevention. And it's important to note that the schools are required to cover these topics, but it doesn't necessarily mean it's required in every single grade level. So we might not be at 100%, and that's okay, because it might not be a topic that needs to be taught at each grade level. Another key piece is that health teachers may not be directly teaching the topic. They may be bringing in a public health specialist or a counselor to come in and teach a topic, such as with suicide prevention or child sexual abuse prevention. It's not uncommon for them to bring in someone who's more of a specialist in that area who feels more confident to be able to teach that. But I just wanted to point out we had some increases in these topics. Tobacco prevention increased by 11%, respecting differences increased by 49%, sexual abuse prevention, which is a state requirement, increased by 20%, and then sexually transmitted infections, another state requirement, increased by 11%. And then this is the increase in teachers feeling very confident about teaching certain topics. We know that confidence in our ability to do something is a very important predictor of us doing that thing. It also is really important for reducing burnout. If I feel like I have the confidence in my ability to do an activity, I'm going to feel less exhaustion, less strain to be able to do that, especially with increasing workloads. So this confidence is really important for us. And you can see we've had some pretty strong increases in teachers' confidence to be able to teach topics. Particularly want to note the 83% increase in teachers feeling confident to be able to teach suicide prevention. This may be from us doing skills-based health ed training, but it also may be from getting them high quality curriculum, that they have strong scripts. It really teaches them how to deliver the content, and then we provide trainings that go along with it. And then I wanted to point out that what I've been reporting has been mostly on just health ed, but we work on areas outside of health ed. And I just wanted to give a quick snapshot of, this is our work. If we look at just substance use prevention, these are 3 curricula that we have in place for substance use prevention, which also address other student health outcomes. This is a program that we have in place that addressed family engagement, school climate and culture, and linkages to care. This is another program that also did the same thing, but in another area. It worked on early intervention and referrals. And then we support bringing in and helping staff know when to navigate to these other, what we call tertiary prevention or tier 3 supports, which are treatment, which reduce students' unmet health needs. And then this is a new program that we just trained all of our public health staff in, which really ties all of this together. So the work that we do is really weaving together an array of different programs that all work in complement across different service areas. And so a set of staff may be understanding these top 3, another group of staff that we work with work on another 3, another group of staff work on another handful of programs. So most of them wouldn't know all of what we're doing, but they know their part. This is my last one. Just wanted to update on annual reports and evaluation. We still aim to put out an annual report every year. We're expecting those every September. These usually will report what we did that year, any changes to the school health scores using the CDC tool that we use, and then our successes and challenges. And then we are working on a program outcome evaluation. We expect to have the first formal program evaluation in fall 2025, and then we're aiming or proposing to do that every 4 years, knowing that we could do them every 2 years, but it takes a lot of analysis, a lot of prep work, and there's small changes that happen over 2 years. So we would like to look at it every 4 years. And this will include monitoring changes to student health metrics. And then I think this is just where we end and answer questions or have any comments. Or did you want to say anything else to add to?
I think a couple things that I'd just like to say in closing. One is, and I think you heard this loud and clear in Amy's presentation, but we have the access to the students. We have the school structures. We have health educators in our school. We do not have the expertise in prevention that our health specialists do. And so their leadership and partnership has just transformed. I mean, I think that the results that you see from our health educators, and I feel like all across the board, we all know we don't have the resources to do everything we want to do. And so innovative partnerships like this, where we can bring your expertise and our access together, is a win-win. And Federal High Schools is fully committed for the long run. We believe in this program, and we've seen even in a year and a half differences, both in those tier 1 systems and in some of the tier 2 programs like Upshift that Amy referenced briefly.
Well, I'll just say that 2 years ago, or whenever it was that we made those budget decisions, you all were able to deliver share a vision with us of what was possible, and it's really exciting to me to see how that vision is actually translating into concrete capacity within these schools to analyze what the needs are, to strategize on how you accomplish goals and set up plans and to deliver. You're at the point where you're delivering all these practices and curriculum that are going to help keep our kids healthy and on the right track so that they can be successful. And that's really exciting. So thank you for all of your work.
Commissioner Dare, do you have any comments? Get off my, you get nothing?
I know, where'd my mouse go?
Okay.
Okay, well, I heard a very frightening statistic yesterday that more revenue was spent on marijuana in the United States last year than chocolate. And I can't think that that is going to be good for our country, and especially our kids. And so anyway, when I heard that, and then I'm wondering, we saw horrific graduation rates from Lapine High School. And I believe, Amanda's been there now for what, a year and a half? Is this program going to help bring those graduation rates up in a couple months when those seniors will be graduating? Do we have any kind of projection? Does it look like the trend is changing because of all this energy put into really helping the program?
Well, I don't, as far as I haven't looked at the data for that yet. That's a fair piece, and we could look at the on track data and bring that back. I think definitely around the structures and the systems for addressing the needs of the kids, particularly in mental health. And so that part is in place. There was some family outreach that was happening last week as well during conferences. So there's, I think are we there yet? No. But the structures and components are like we're at that short-term space rather than the long-term place.
And I would add, Commissioner Adair, that there's not a single silver bullet solution to that. There are probably 100 things that we're trying to work on. We have new leadership at the building in the last, this is Scott's second year. We have a very strong principal and assistant principal team at the school. And we have to look at where the students are academically. We have to look at their social, emotional, behavioral health needs, which I do think this program, the Healthy Schools Initiative, is addressing. Attendance, we're looking at putting in actually a systemic supports for attendance. K-12 in Lapine, that's an area where we struggle to have students attend regularly to school, though we see it elsewhere in the district as well. So yes, you bring up a great point. Those are very low graduation rates, and there's a lot of attention being paid to that.
I do think, just to circle back to what Jessica had mentioned about Lapine's principal said that the process of having the school health team working was able to increase their FTE. And now they will have a full-time grad coach there, and the role of the grad coach is to identify students in their freshman year and help them become on track and move them through towards graduation. So for me, when I'm looking at data, I would expect to see change in trend in 4 years when those students have that full-time grad coach moving them through that process. And that's also why we look at our outcome data, every 4 years, knowing that it takes time to be able to start early and to be able to hold students before we lose them to chronic absenteeism or lose them to other family needs that they have.
Well, I would think, because we saw how low the graduation numbers were in Lapine, I would think that if a student is missing a class, somebody at the school would be calling the parents and saying, gee, why isn't your son in school today, or why isn't your daughter in school today? Talking to my sister, who is a Hermiston High School teacher, she's been teaching for 36 years, and listening to her issues, and I cannot believe how Maureen has to follow up and find out where students are, and they're missing something. And yes, so definitely the more things that can be done, the sooner, I would believe, would make a difference. Why do we need to wait 4 years? I would be hoping that a program with this high of expectations as this program has, we would see a difference like within this year. Haven't we been there? We have been there. This will be the second year, right?
We're in the second year at Lapine High.
Right. Okay. Well, I'm just hoping that, it definitely has carried over, and graduation rates are improving, and people understand how important it is for the kids, because they've been missing out on a lot for with COVID for a couple of years now. So I really appreciate the program, and I'm hoping that we see results that show that its impact is worth every dollar that we spend.
And I just wanted to assure you that as a parent of a high school kid in the Bend Lapine school system, I get a notification every single class that my kid misses, and occasionally a notification that he missed something that he was actually there at. So the school system is very good at tracking attendance. That doesn't mean that they can make the kid show up, but certainly the process of tracking attendance and notifying parents is pretty robust.
But is that same system functioning in Lapine?
Yes,
Mhm.
yeah, that's
It
a
is.
district expectation.
Yep.
Okay. Well,
So we're going to another budget year. Is this a step in the budget cost of this program, or where are we at there?
I'm sorry, tell me the
We're
question.
going into budget this year.
Yeah,
This program's been on the books for a couple of years. Are we stepping it up this year? That's the next step?
so the special request that's before the budget committee this year is to complete the phase-in. So we're not fully implemented right now. So the final phase is to add the one public health specialist to serve Caldera. And so that's what you'll see at the.
Will you wait till the end of the budget? Okay, sorry, I see here in this box pending budget approval. So you're gonna wait till the end of the budget process to run that final position.
We are recruiting for that now, but the actual hire will be pending budget approval.
Great. Thank you very much for the update.
Yeah, thank you.
Thanks for having us.
oh, what is the cost to our budget for this additional? Jessica, do you have that number for us?
So go ahead. I do have the number. The special request ask of the budget committee is $23,096 and 1 FTE. Not the cost, but we need the FTE, and the difference from the resources that have been put forward are coming to the budget committee is 23,096.
Because part of that includes the school match piece, right?
Yeah, that's a 50-50 match.
Thank you.
Dollars will get us a whole nother person.
Oh, well, yeah, that actually, the details behind that, I might need some assistance with. That's a good question for Cheryl. But the what we need right now is 23,000.
Okay, thank you so much.
Thank you.
Thank you.
We have this all recorded so that if any of the members of our budget committee are interested in reviewing this information, they could review it as well. We could kind of like, you don't have to like clip it out, but just kind of like note the the date, timestamp, and just have all that information easily available.
Yeah, we could also send them a copy of the presentation. I mean, I know it's available online, but just make it easy for them.
Okay, so at this time, other items. As I say, we did 2 interviews for the Regional Solutions Central Oregon region. So this position is going to cover 5, Deschutes, Crook, Jefferson, Lake, and County. So that's going to be how the footprint sits for this Regional Solutions person. Neely Porterfield was there, and Commissioner Schellenberger from Lake County was in the interviews with this also. And the decision to be made by governor's office, so there will be some recommendations here. We'll see what it looks like in another week or 2, maybe. Any other updates?
I have a I have a topic I'm interested in discussing, which is the presentation from the Veterans Village. I thought we were going to have a presentation from Kobo and the team from Veterans Village. And I just heard recently from them that they're supposed to give information to Cheyenne Currington, who will then deliver that to us now. And I just wanted to understand how that change occurred and why we're doing it that way now.
So you're,
And I also, I'd like that not to be a final decision. I'm interested in having Kobo and Heroes Foundation come and give us a presentation directly.
so it sounds like you're focused on me.
Well, I
wasn't aware of Cheyenne's involvement.
Well, so there was a agenda request, and I asked for us to have sit downs, or at least myself, before it gets to the to this work session situation. I suggest that when it comes to homeless and houseless issues, that we would use Cheyenne. So you're saying we shouldn't, and I'm saying maybe we should. So it's a great discussion to have.
I'm saying Cheyenne can be there, Cheyenne can be participate in the conversation, but I want to hear directly from Kobo and from the Bend Heroes Foundation how their project is going. And we have developed a long-term relationship and are making direct investments in their work, not through Cheyenne. Or is their work? Coordinated homeless. What is their work? Their work is building and operating the Veterans Village.
For what purpose? For homeless?
For the purpose of moving homeless veterans out of homelessness.
We have a coordinated homeless office, and I would like to coordinate with the coordinated homeless office as these discussions come. So, I mean, you're making a pretty strong statement saying you want to hear from them directly. I'm asking that, well, what does it look like? Is there more coordination here? So, yeah.
Yeah, I would like to speak with them directly. I mean, it's their project. They've been working on it for a very long time. They have built a relationship directly with the Board of Commissioners. And I think it's appropriate for them to be able to come and speak with us directly, rather than trying to take J.W. Terry or somebody else's, triple the time that they have to spend to come and speak. to each of us individually.
Thank you.
So how does this decision get made? Is it, is this basically a chair decision that has been made already, or is this something that commissioners actually get to discuss?
Well, we can discuss anything. There was an agenda request and I asked it to be pulled for this week so I could sit down with them and understand. My thought process is that if they sit in front of us and they say, hey, we've got a great idea, how about we add 7 more cabins out there? Okay, so now we're in a public meeting, which we're talking now, which is fine. We're in a public meeting, the veterans sat in front of us, said we want 7 more cabins. And then do we say yes or no right away? Oh, well, that's a great idea, go do that. I mean, let's look at what that means to the capacity of house lists. Do we really want to do that on that property? My thought was 15 people would be about the right size for a property. Once you go past that, which we were told, is it becomes, kind of a little bit more next level of management. So I just wanted to have a discussion with them. So you're challenging me that you want to see them here now in front of all of us. And my choice was to sit down with them individually beforehand.
I mean, if they come to a public meeting and they say, hey, we'd like to add 7 more units, there's nothing that prevents us from saying, interesting idea, let's answer X, Y, and Z question about that before we make a decision. I don't understand why that has to happen in secret.
Don't imply secret here. People talk all the time everywhere. There's lots of communication going on. I mean, I really do feel like you're challenging this situation pretty aggressively, and I don't mind talking about it, but
I understood that they were coming to talk to us, and then it was not on the agenda. And then I saw things show up on my calendar for times that I was already scheduled to do other things. And kind of bending my schedule out of shape to do something offline that we could be doing online, which I think is an appropriate place to do that. That does bother me. Yeah.
let's just say I absolutely, there's a lot of moving parts here. And I've got a pretty clear thought about what I want to see happen. And it's, if we're gonna do a coordinated homeless office, people don't come to us directly. I mean, why do we manage homeless issues at the Board of Commissioners if we just hired somebody in coordination with the city and the tri-county area with, or the county area, with support from the legislature? We're still dropping stuff in front of us directly.
The Coordinated Homeless Response Office is meant to help us coordinate with the other local governments. The Coordinated Homeless Response Office doesn't need to be stuck in the middle of our relationship with service providers. And I don't think the Coordinated Homeless Response Office is doing a great job of mediating or kind of being in the middle of our relationship with service providers anyway. So I for an entity like, for a project like the Veterans Village, where we have a direct codified relationship with COBO, with the Ben Heroes Foundation, I don't see any reason that we have to put the Coordinated Homeless Response Office in the middle of it.
Any thoughts, Commissioner Dare? Good discussion here today.
Yes, I must unmute myself first. Well, the really wonderful news is it's been in existence for 17 months. 12 veterans have moved on to permanent housing. Let's hope that holds true for them for the next 2 years. So we really see that the support services that they receive through Dave and COBO really are making that huge difference. And I would love to have them come in as soon as possible, because we were told when we visited Clackamas September 1st of 2020 that when you go over 15, you get into personality disagreements. So that's why, it was at 15. If they think that we are capable, we definitely have the room there. And I would hope that we could get going on it, at least hear them in our meeting sooner rather than later. And then the other thing I did meet, I had coffee Friday morning with Colleen Sinsky, who runs Fuse. And she explained that in the last year and a half, her program has been able to transition 44 people to more permanent housing. So, you know, it's good to know that there are some positive things happening in our community. You know, we still have a lot to consider, but yeah, Veterans Village, I so appreciate that program, and I'm so thankful that we have it. And, you know, just hoping that we can get the bunkhouse going in La Pine sooner or later. More veterans down there.
And if we invite them in directly to a public meeting, then we can also celebrate the work that they've accomplished and you know, give them some recognition for what they've done as well, which is not something you can do in private one-on-one meetings.
Great. Well, so yeah, I mean, you're showing support for wanting to see them directly. You may or may not meet with them individually, so you can, you know, not meet with them. It shows up on your schedule. I want to meet with them individually, and we'll get it scheduled. You know, it's not scheduled for this week. Maybe it'll be next week now.
And we can flag for them that we have heard various concerns about having a facility that is bigger than 15 units, and ask them if, you know, if they're interested in discussing that, to come with some, you know, pretty good information about, you know, what makes that okay or not okay.
I can talk to them about that when I meet with them before we have a public meeting.
Or we could just ask them to bring that information when they come and talk to us.
That's what I'm going to do on my one-on-one with them before our public meeting, unless you were planning on doing that.
No, that's fine. You can do that. If we're
Okay.
going, if they're coming in here in a week or two, then I don't have to meet with them in advance.
Oh, yeah, no,
Because I could just talk to them on the phone if I really want to.
So it sounds like Commissioner DeBonne would still like to meet with them, with Cheyenne there. Commissioner Chang, it sounds like you don't want or need to meet with them ahead of time.
Assuming that they're coming in a week or two, then for a public meeting, then I don't. That's fine.
And Commissioner Dare, your preference for you?
I talk to these people quite a bit, so I'm really fine. I don't have to have a private meeting with them. And I have repeated my concern over going above 15, you know, maybe taking it slow, 2 more, and then if that works, you know, knowing that you can add 7. But I would do it kind of slowly, and usually building something takes a bit longer than we always think anyway. Can I go to my other items now at this time?
Are you all set with that? Sure. Yes, please.
Okay, I did want to acknowledge and thank Chief Tim Moore for his service in Sun River. They did have a retirement event for him last Thursday at 2, acknowledging that now he's going to retire permanently in Redmond and not have to drive to Sun River. And then we had the Health Council meeting in Jefferson County at St. Charles in Madras on Thursday. And this is the really sad story, is that Jefferson County is his health metrics are at the bottom of our state, and Deschutes isn't at the top, but it's up there normally, but Jefferson County is at the bottom. And we were talking about it in that group. What is it we can do to make a difference? And even just getting the road safer would be incredibly helpful. And then at last Thursday afternoon, we had the COAC meeting where experts in the field brought in the information regarding electric vehicles in the trucking industry that California is going to be passing. And if that legislation comes to Oregon, like normally it's approved as soon as it goes through California, we could have some serious issues with our trucking. So Chris Doty was, of course, part of that conversation. It was really, we don't have the infrastructure to support electric vehicles, especially in trucking. It takes like 90 minutes to charge one. And the state of California is saying that you can only buy a gas operated snow plow, and it can't be used for anything else but snow. So yeah, the rules are really, I think we need to get ahead of that game, or it's going to be just more challenges for our state. But those were the important things that I think to bring up today.
Great. So one other note, last Thursday, I was able to fly a helicopter tour with Melanie Keebler, the mayor of Bend. This is the Bend Airport director invitation. So we also were out with a couple other staff from the city of Bend. So there were 6 of us in the helicopter. We were able to go up to Ridge Creek and see Tumalo Falls. Came back. It's real interesting seeing the edges of town where the urban growth boundary meets the rural on the east and the west side of Bend. Then we flew back over kind of a Juniper Ridge area up to Redmond, across the city of Redmond, south of the airport, but then north over on the east side of Redmond, and then made our way back. And it's really interesting. As soon as we turn around, you can see the natural gas pipeline and the irrigation canal, from the sky, and everything. The proportions are so interesting seeing them from the sky. I felt like we were going really slow up there, and he said, "Oh, we're going about 110 miles an hour." So just all the perceptions are different. And then right after that, I drove from Bend Airport to the Redmond Airport for the airport committee meeting. So, the city of Redmond approved the raise in the parking lot fee. So that's coming out May 1st. So that's coming here pretty soon. But it's all about prepping for the financial package. They expect infrastructure dollars and FAA dollars and bonding to come together in like $200 million numbers for the big second floor improvements with the people connections to the airplanes, the people tunnels. I don't think that beats there. I think that's it. Anything else? Other item?
Yeah, I was going to mention, commissioners, I sent an email earlier today on the Cannabis Advisory Panel membership. Last week, we talked about a member who attended the first meeting but hasn't been able to attend since. Staff reached out several different ways and hadn't heard back. So the board said, yes, go ahead and schedule on the agenda to remove the person. We just heard from this weekend from the person, and they have resigned. So what we'd like to do is, it's on your consent agenda for Wednesday. The recommendation is to pull the item from consent and then to change the letter that just thanks the person for their service. And there's a draft letter that was sent via email.
So you're proposing that we change the agenda now and publish it?
I don't think we need to change it. We can
just do that real time.
Yeah, it's on consent agenda.
Yeah.
And so the board, it's the only item on consent. The board can just pull it and then amend the letter to just thank him for his service.
Got it. Okay. I think we nail that.
Great, thank you.
Thank you. Anything else? Okay, so we do have executive sessions today. Yep. So executive session, this will be under E2E. Yep. 192.